All right, so Assalamualaikum and good afternoon to all the participants. Thank you, organizing committee, for inviting me for giving this talk, Training Pathways of Internal Medicine. My name is Ruhaiza. I'm a physician in Hospital Melaka. And I will talk about how to be in the training pathways for internal medicine. Okay. So before we go into details about the training pathways, I'm sure for the medical officers or even housemen and medical students, you probably want to know in detail what internal medicine is about, okay? So in general, internal medicine specialty is about looking after adult patients. Everybody knows that. But in Malaysia, don't be surprised that we also look after those who have IC, meaning age 12 and above, unlike in the UK. But essentially, most patients that require non-surgical treatment will belong under the medical department. So sometimes even the patients going for surgery, medical team will need to co-manage the patients to stabilize them before or after surgery, okay? So other than giving treatment, we also focus on prevention, especially secondary prevention, making clinical assessment to come up with the diagnosis, and commencing treatment, either pharmacological or non-pharmacological, of the adult patients. So if you're in the medical department, you need to really know about medicine and drugs, because sometimes people may ask you that, okay, quite a lot. And you will see wide spectrum types of patients, from acute illness to chronic illness, and sometimes you even have to get involved helping them with their socioeconomic problems to provide the best medical care for the patients. So because of the reason I talked earlier, it's not surprising that internal medicine specialty is usually the biggest department in hospital. We have highest number of inpatients, outpatients, huge number of medical beds, sometimes medical wards. Even the staff number also is huge. If you can see the blurred picture down there, that was taken one of the Raya gatherings pre-COVID era, and that's about 10% of our internal medical team that we managed to capture. So you could imagine it, how big, and sometimes you may not even don't know your other colleagues, okay? And certain hospitals, especially tertiary or state hospital, may have medical department even separated from certain medical subspecialty because it is big, such as nephrology. It used to be in Hospital Melaka where we had separate nephrology department. But because of their department is big, they have their own separate budgets, staffing, assets, and so forth. For example, hepatology also, it's a standalone department in Hospital Selayang, and of course, cardiology in Hospital Sedang. However, if you look at this diagram here, of course, internal medicine specialty has numerous and diverse subspecialties, which you can pursue later on once you complete internal medicine training. The famous one is cardiology, but of course we have endocrinology, gastroenterology, geriatrics, hematology, infectious disease, which is now very important in combating the pandemic COVID, acute internal medicine, which is something that developed over the last 5 years or so, nephrology, neurology, pulmonology, previously known as respiratory medicine, and rheumatology. Those I highlighted in red circle are the ones available in Hospital Melaka. So if you can see, not all subspecialties available within that medical department, even though you are in a big hospital or state hospital. But if you need input from this specific subspecialty, you can always refer to the nearest tertiary center. So because of the diverse subspecialty that's available, the range of work environments also varies. Okay, if you are under acute internal medicine sub, you probably have to work mostly around the initial assessment unit, such as medical assessment unit, or if your hospital had a lot of lodges and have lodging area, you probably work in that lodging area or work closely with the emergency department. But if you are with the rehabilitation medicine, you'll probably be working in the rehabilitation center together with the physiotherapy and so forth. But if you're working with the cardiology subspecialty, you may get a chance to be in the cardiac lab, helping with the procedures, okay? And also even looking after patients in coronary care unit, which has some elements to critical care management there. But as a doctor, you cannot run away working in the general ward, either it's acute or chronic wards, and even outpatient. So hopefully by that briefing, I managed to convince you to join me in internal medicine specialty. So what do you need to do then if you really want to pursue this specialty? Okay, there are two ways to pursue the training pathway in internal medicine. One is through Master in Medicine, what we call it MMed, which is under the Ministry of Education. And second is Internal Medicine Parallel Pathway, which is under the Ministry of Health. So let us go into Master in Medicine. So for Master in Medicine, basically it's a program under university hospitals. So far as I know, there are 5 universities that's offering this program: USM, UKM, UPM, and UITM. And for you to apply for this, you need to sit for the pre-entrance exam, what they call it MEDEX exam. So pre-entrance for specialist training conducted by Lembaga Peperiksaan Malaysia. And once you pass, you will need to also pass the interview session before you get accepted into the program. And you will make the application through Bahagian Pengurusan Latihan Persekutuan, KKM. So for you to be able to apply, there are a few requirements that you need to have from the Bahagian Latihan perspective. First, you need to be a medical officer with permanent and confirmed post. Your age must be less than 43. You have a medical degree from university recognized by KKM. You must be an MO with clinical experience at least 1 year post full MMC registration, or at least 3 years service with KKM. And you need to have yearly assessment mark, or what we call it Laporan Nilai Tahunan, Purata Tahunan LMPT, more than 85% for the last 3 years. So once you achieve and you granted this hadiah latihan, they call it, you will be given a scholarship to pay for the university fee, and you get the study leave with full pay. So what it is in Master, it is a 4-year program. You can either be in campus or both. In the past, most of you, the trained one will be in campus. There are shortage of medical officer in the KKM hospital. Then the university allow us to be out campus for 2 years. Okay, so once you accepted, the university will give you the co-curriculum and the program structured, and there will be examination schedule at your first, third, and fourth years end of the year, combining all master students from all over the universities. Okay, this exam can be theory. It is a part of the theory and clinical exam, and the clinical part is divided further into OSCE and long cases. If you fail the exam, you may resit in 6 months. So each examination has got 2 scheduled over the year for you to sit. Okay. At the end of the 4 years and you pass all the exam, you'll be given a degree in Master of Medicine, which will be awarded during graduation ceremony of that universities. Okay. And you'll then recognize in Malaysia to practice as specialist or proceed with the gazettement. Okay, so now let's move on to the internal medicine parallel pathway. It's again a 4-year program with supervised medical training and completing MRCP, which is the membership of Royal College of Physicians examinations during the training. Actually, this parallel pathway has been around for many years, but for the last kind of 5 years or so, we have revamped and make it more structured. and sort of suited for the current working environment for the trainers, okay? And you will apply through bahagian perkembangan KKM. Okay, what it is a curriculum-based program of supervised medical training. So that's very important, okay? And each candidate will be assigned to a mentor throughout the training period. And this program helps to facilitate and enhance MO training because you can be trained anywhere. It highlights the spectrum of case exposure, okay, during the training rather than rotations. And these supervised learning events can be done at any KKM facilities. So meaning that you cannot be demanded to be placed in a tertiary or big hospitals only for you to be able to do the internal medicine parallel pathway, okay? So when you apply, you need to have registration, full registration with MMC. So basically you must complete your housemanship and you must pass the Part 1 MRCP, either UK or Ireland, okay? And once you've applied, I think in 2019, there is a latest perkeliling to say that anyone who joining parallel pathway must be registered with KKM. But for internal medicine, we have made it more strict and compulsory even 2017 to 18. Okay, it is very important because your training date will start from the day you register, not from the day you pass. Okay, so once you registered, you'll be given a registration number, the date, and also the portfolio, or what you call PDP, personal development plan for yourself, okay, to complete throughout the training. And for those who are thinking about doing MRCP exam, so the exam itself consists of 3 parts, okay? The written part 1 for MRCP Ireland, it can be done as early as 6 months. Graduation from graduation of med school, and for MRCP UK as early as 1 year. Okay, so you can do this actually during your housemanship. Then you can do the written part 2 and clinical examination phases, which consists of a few stations, long case and short case. Okay, the downside of it that you have to pay the examination fee yourself. The last I checked for written part 1 costs about 3,000. But if you acquire the certificate, then you be recognized internationally. Okay. So for us in internal medicine parallel pathway, we have created this website. It is very useful. Please browse through it. It has information for trainees and also for trainer. So both will know what are their roles, what need to be done, okay? In this website, there is a PDP or Personal Development Plan case exposure and procedure log. Okay? So you can browse through what kind of procedure and cases are expected for you to be signed off and know throughout your training, and the timeline and assessment flow. So basically, how often you need to do the assessment and so forth, okay? The most important, you can also download WBA, which is work-based assessment, assessment form, which is very important. Even as a houseman, you will need to complete this, which consists of directly observed procedure, mini clinical examination, case-based discussion, source feedbacks, and how to do, assess the referral letter and case summary. So please look through it. And for the trainee supervisor, you also need to know what kind of report, mentor report, training supervisor report, and final mentor report that you need to do for your trainees, okay? So please, again, browse through the website, okay? And once you complete the 4-year, or at least 48 months of the training from the date of registration, you complete all the assessment form, procedure, and case exposure, then pass all the MRCP exams, you will be then given a certificate of completion supervised training. Okay. But you need to be sure that you complete all the forms. Okay, sometimes when we do the review of this PDP, there are a few things are missing. So we will return the PDP back to you to complete before we can give you the certificate. So what happened after that? So once you complete the master or parallel pathway training, you can, once you have that certificate, then you can proceed into 6 months gazettement, okay, as pakar clinical or prawarta, yeah. And during that 6 months gazettement period, you will need to again make sure that your logbook and report is up to date, and at the end of the 6 months, you will submit them to KKM for a review, okay. And the gazettement document will then be reviewed by KKM by the community members, and they will issue gazettement letter KKM for you to say that you complete the okay. And with this letter, you can apply for National Specialist Registry. It is important nowadays as pakar for you to be registered to NSR, either if you're working in KKM hospital or even in the private, especially more so, okay? So I think that's pretty much my talk today. I hope I managed to convince you to join. I think it'll be more question and answer after this, but as a medical doctor, our training never stopped there. We always have to continue our education even after that, and to be a better doctor and to provide the best medical care. So I wish you good luck, and thank you for listening. So any questions?
Thank you very much, Dr. Ruhaiza, for the very informative session. Dr. Ruhaiza will now be taking questions that is in the chat box.
I'm trying to see where's the...
Doctor, you can stop sharing your screen first. Then you can see the chat function on the below.
Okay. Okay, let me go through the... Okay, I have the first question here. May I know from Eunice? Okay. Hi, doctor. How may I know which of these two pathways is better if I'm planning to be a cardiologist? Following that, how is the timeline to become a cardiologist? Thank you. Wow, that's good. Okay. So, which of these two is better? If you already know what's up. Okay, in terms of internal, if you want to become a cardiologist, you need to really know about internal medicine, and you need to be gazetted, okay? So basically, with regards to master or parallel pathway, the fastest people say it will be internal medicine parallel pathway. But you have to bear the cost of the fees, exam fees, okay? And you know, it is not that cheap for one exam. So if you really know and you already have that and you really want to to do it fast, so this is one of the way. Because for master, you do have to take exam, a separate exam and also interview, and you need to apply the scholarship, okay? So after you enroll the parallel pathway to ensure that you pass the training throughout that 4 years. You then can be gazetted, and usually after gazettement, depends, 1 year or 18 months, you can apply for the sub in cardiology. So it depends. For the sub, which I did not include in details here, it depends on that particular subspecialty too. If sometimes it can be even faster or even later, depends how many trainees they have. Okay, so I hope I answered the question. So second, from Nurul, would like to know if the countries that recognize MRCP are only UK and Ireland. Actually, MRCP exam is taken all over the world. So it is recognized, but the center of exam is only UK and Ireland, but people who taking this exam are everywhere. So once you have this MRCP, it also recognized everywhere because they're also doing it. Okay. Next, may I know what is the difference between MRCP Ireland and MRCP UK? Besides, we can take, please. Oh, as I said earlier, Ireland you can take as early as 6 months after finish med school compared to UK. But apart from that, the part 1, part 2 bases are all the same, as far as I know. Okay. Next, may I know which of these 2 pathways is better? Okay, sorry. Again, dah sama tadi. Just to double confirm, when can we take MRCP written part 2? Once you have part 1, you can take part 2. So that's the answer. Okay. In case of contract MO, can they still take the parallel pathway? Okay. Actually, this talk is not going to touch much about contract versus permanent, but if you see the entry requirement, it does not mention anything about having a contract or permanent MO, meaning you can apply. Okay. So once you've got your MMC, full MMC registration number, and you pass your MRCP part 1, please register and apply to bahagian perkembangan KKM. Sometimes the MO did the exam, but they're not sure whether they want to register or not, because maybe they have other issues like a family, or or they kind of undecided and they wait until later. It's fine, but you have to bear the consequence that your training will be longer, because we are taking the date of registration, not the date of passing the exam. Okay. Next, I would like to ask, after passing MRCP, what is the pathway for further subspecialism? Oh, okay. So basically, after you, let's say you've done the internal, you completed the internal parallel pathway, you then proceed with gazettement. Okay, gazettement will be minimum of 6 months. Okay, if you also complete and pass the gazettement with no issues, as I said, usually 1 year after your gazettement. But it again depends on the subspecialty itself. You have to keep asking and kind of watching lah when they are opening the session to apply for the sub. Doctor, could you explain more about gazettement period? What is gazettement period? Okay, so gazettement period is basically post internal medicine parallel pathway and master in medicine. So you've completed the training as the medical officer in medicine and you want to become a specialist. Okay, so you need to be gazetted, okay, in KKM hospital. So this gazettement is actually 6 months. In the past, for parallel pathway, for MRCP, it was 18 months. But now, because we have some sort of organize it to be together the same as master, okay, so for 48 months in training, it will only be 6 months. Okay, in the past, it will be once you complete MRCP, after that 18 months. Yeah. But now must be internal training for 48 months, then 6 months assessment. Either you master or parallel pathway. And during this time, you will be expected to carry a duty of pakar, okay? And you will still complete your logbook, but you need to be supervised by a consultant so that they can make assessment and reports on you. And most of the time, you can complete with 6 months. But in case you still cannot perform, your consultant or supervisor may decide to extend you, okay? And then once you complete that 6 months at least, or more if you need to be extended, submit all the logbook and the reports to the Jawatankuasa Gazetteman, and they will then have a meeting and basically said, okay, you pass and granted you the surat perwataan. Okay. And from there on, you already classified as pakar lah, pakar perubatan. Okay. Next, good afternoon. May I ask about number of intakes and the competitiveness for MMed pathway in public university? Oh, number of intakes. Now, to be honest, I'm not really sure the number of intakes. But the MMed is usually quite competitive because you need to get this scholarship from bahagian latihan persekutuan. Okay, and you also need to be sure that you pass the MMed and the interview session. Okay, but internal parallel pathway, you can just do your exam and enroll in that. Okay. Next, if we get only temporary MO contract, do we still have a chance to take subspecialty? Oh, this is not easy for me to answer because this contract, the permanent post, it is still ongoing things, even at the higher up. Okay. If maybe, is there any someone else here from, maybe I can open this later to, if Dr. Paras is here to answer your question, because it is beyond for me to answer. This contract and permanent status are still debatable actually. But I'll try to get back to you, okay? Next, I was just wondering if clinical immunology is a specialty recognized by NSR because it is not listed as one of the specialties in the website. Thank you for time. I'm afraid I don't really know about this either. But I will try and get back to you once we have I have more information. Because I think in NSR it is quite specific, but whether you need to be under the specific heading or pathologists may be able to help. As far as I know, none of the under internal medicine actually have sub in the clinical immunology per se. Next, if we are to take MRCP, do we need to move to tertiary hospital for training or can be done in secondary? I think I've kind of mentioned earlier, nowadays for MRCP training, it can be done anywhere as long as there is pakar there. There is a specialist physician there, okay? So even in a smaller hospital, especially now KKM is adopting cluster hospitals, meaning you have a state or big hospital who also see and also working in your non-lead cluster hospital, for example, in Melaka. So definitely there will be a specialist there, meaning you can move around in that cluster hospitals in that region. Okay. I would like to ask if we took a master program in overseas, like for example, Indonesia, have a direct subspecialties in cardiology, do we still need to take MRCP or any other exams to work in Malaysia? Master program in overseas, if you want to sub. Okay, if you want to sub, because I think the most important is you need to be able to gazette in KKM hospital. And for you to be able to gazette in KKM hospital, there are two internal medicine pathways that I mentioned earlier, training pathways, which is either through the Master in Medicine or internal medicine parallel pathway in Malaysia. So I think if you're taking it in Indonesia, I'm afraid that you still need to take MRCP, or you probably have to take the Master in Medicine program. Next, how would the gazettement work if we work under contract MO? Okay, I think this contract MO batch, so far none of your batch entering gazettement yet, okay? Because it is something new. To be honest, I'm also not sure, but I hope in future will be more clearer, okay? Next, in case of floating MO, we need to be in medicine department to apply for parallel pathway, or we will be transferred after getting registered. Okay, so basically, you can enroll the internal medicine parallel pathway once you complete your part 1 written and your MMC. So as a floating MO, you can actually apply. But if you are working outside medical department, we will still be able to take into account of that training at least, I think, 4 months. And then during that period, please try your best to talk to your HOD department to basically place you or into the medical department rather than being left in the non-medical department area, for example, KK or surgical, that kind of thing. Okay, next. I would like to ask, if we took MRCP and trained in UK, will we be able to come back and work in Malaysia? This is like me, okay? So what happened after I finished my MRCP? Yes, I came back as a medical officer, but gazettement. So I proceeded to my gazettement during that time. But in your case, because we want to take in that 48 months, okay, of internal medicine parallel pathway, even if you have that MRCP, unfortunately, you may have to enter that internal parallel pathway 48 months before you can gazette it. Right. What is the pathway for subspecialization? I think we already said you need to be gazetted first, and after 1 year, you can apply for that sub. I would like to ask if I can go through parallel pathway to become a medical oncologist in Malaysia. I saw some online comments that say to be oncologist, we have to go through local program. Okay, yeah, I think in Malaysia it's slightly different for oncologists. They do have a local program, which means that you not necessarily have to go into internal medicine parallel pathway and an MRCP. But I'm afraid I cannot answer you in full detail, but there is a local program for that oncologist. You're right, okay? Next, does JPA sponsor any of these pathways if I am a current JPA scholar? JPA scholar, okay, if you're a current JPA scholar at med school, then it's only for the degree. After that, you will have to apply. As I said earlier, for master is under bahagian latihan persekutuan. Okay. Right. Next, will it be difficult for one who complete IMT training in the UK and come back to serve Malaysia as a specialist? Okay, so I think I've answered that. You can still come back to work in hospital if you completed MRCP, but that part of training and gazettement that you need to go through still. Okay. if we subspecialize in a certain field, do we still get to see all internal medical patients in wards, or will still only attend to specific case? Okay. Right. In Malaysia, the subspecialties, we're actually quite limited in numbers. Okay. So if you train in sub, most of the time, if you're in state hospital, there'll be 1 or 2 in that particular sub only. Okay. And you cannot do all the sub work alone. Yeah? So because of that, the burden have to be shared with others. So unless you are in a department, usually if your sub is your standalone department, yes, you may have more people in that team and you can focus on the sub work. But otherwise, you will still be a general physician on top of your sub.
Doctor,
Okay.
we're going to start for the next session.
Okay, all right. So I'm afraid I have to stop now. Thank you very much for your questions. But I think for those yang I couldn't answer, perhaps I will get back to you, Ms. Kassim University, how to be able to give the feedback to you. Okay, thank you very much.
Thank you, Dr. Ruhaiza, for the excellent session. I'm sure the participant will be leaving the session today with much clearer understanding on what is required in achieving their dreams of being specialists in the field of internal medicine. Once again, thank you very much, Doctor.
You're welcome.
Dear delegates, I hope you have found the session informative. Please do not forget to sign into the next session that will be starting in 5 minutes time. Dr. Ruhaiza, can I ask you to sign in into the Zoom link for the second session immediately after this? Okay, thank you. Thank you everyone and have a nice day.